This is Dr. Namratha from Bangalore Medical College, Victoria Hospitals. As the epidemic report says, in the upcoming few months, we will be facing the third wave. So no single method can help us tackle or manage the third wave. So a multi-pronged approach is always necessary. So to begin with, we resident doctors have come up with few suggestions also. It can be planned these factors at various levels, at hospital level, at individual level, at community level, at workplace levels, and even at the laboratory levels. India is a hub of human resources. It's rich in human resources. So, but the trained healthcare workers are very much deficient towards the healthcare system. So what we suggest is, there is a hub of, we need to pool so many medical students, a huge number of medical students who are taking only the theoretical knowledge. As a part of their clinical postings, they need to be posted at the community level and even at the hospital level, and under one trained healthcare worker, so that a trained healthcare workers can guide all these students to manage the patients and to manage at the community level whatever the problems are. So the various factors we need to focus on are the information, education and communication. India has the highest percentage of malnutrition children, under 5 malnutrition children. As it is said, the third wave is mainly going to affect children, with the simple reason is that the vaccination drive is not being still implemented on the children, because whatever the trials, the vaccination for the children are still under trial. Whatever the trial researches are, it has to be hastened up. So mainly the PHCs and the Anganwadis need to be strengthened up. The malnutrition children should be focused on. The malnutrition should be reduced. The rate of malnutrition should be reduced. One more thing is hastening up the vaccination drive. See, the rule we'll have to bring up what need to be done to hasten up the vaccination drive is, we need to bring upon the legislations, like people attending the public program should have the vaccination certificate. People stepping out of the home should have vaccination certificate. Even at workplaces, the vaccination certificate should be made compulsory. And people having less knowledge on the vaccination at the rural areas to reach the remote areas also, government can come up with the plans stating they'll be offered some amount of groceries if they get vaccinated. They'll be benefited with so and so. So these things can be planned accordingly to hasten up the vaccination drive. Next thing is the post-COVID and the long COVID patients. Patients who require long-term hospitalization can be shifted to rehabilitation centers, establishment of the rehabilitation centers. So the hospital oxygen beds can be given to other needy oxygen-dependent patients. And other thing is, the more and more with the virulent strain of the COVID-19 changing with each wave, more number of research activities has to be set up. Research activities has to be fastened up with due conclusions which has to be needed. One more thing is economic established. With each wave coming, we cannot have the solution of lockdown alone, which is making India go economically backwards. What we suggest is come up with the sterilization process, disinfection process, where in the public transportation you can utilize, instead of using liquid disinfectants, UV radiation, which is cost effective, can be utilized for hastening up the disinfection process. So we have come up with all these points for the preparation of the third wave, which may help the government. Thank you.